Let's go through some case examples of how data are used in public health. These examples will underscore the importance of using data and how it can promote and support public health practice when used appropriately. First, I'll describe an example of using data to describe the burden of disease. Then, I'll give an example of how you might use data when you're developing your public health intervention. Finally, I'll describe all the important evaluation application of data. Here is a map of Michigan hospitalization rates for stroke by county taken from a cardiovascular disease surveillance report. The highest rates of stroke hospitalization between 2000 and 2006 were for residents of Luce, Monroe, and Wayne counties. This burden data is used to understand the extent of the burden of stroke and its distribution across Michigan. It also will offer information when considering the underlying reasons for high disease burden, like perhaps issues related to the availability of specialists or the history of public health education programs in the counties. If you were developing a public health intervention for stroke, you might select one of the counties experiencing the highest burden, like Wayne County. This data could also help you engage potential stakeholders, such as recruiting hospitals in the target county. When using data to describe the burden of disease, it is important to present it effectively and interpret it appropriately. In this case, a map is a very effective means to display this stroke hospitalization data visually, and the interpretation of this data is clear that these are the rates of hospitalization and not the prevalence of stroke. Data is also very important to developing or selecting an intervention. Say you're interested in conducting an intervention in a local elementary school to improve indoor air quality and reduce the frequency of asthma symptoms for its students and staff, but you don't know exactly where to begin. First, you turn to the published literature to find interventions that have been tested. And if you understand how to use the data appropriately, you could use this evidence to compare programs and perhaps select one you'd like to replicate in your school based on the evaluation results and the resources that are available to you. Tools for Schools is an intervention developed by the Environmental Protection Agency to reduce exposures to indoor environmental contaminants in school through the voluntary adoption of sound indoor air quality management practices. It uses a practical approach to maintain a healthy environment in school buildings by identifying, correcting, and preventing indoor air quality problems. Being able to understand evaluation data, you'd be able to decide if Tools for Schools was an effective program, whether your available sources could support it, and finally, estimate the potential impact of your program. Increasingly in public health, we are faced with the task of demonstrating the effectiveness of our programs or policies to show that our activities have made an impact. Evaluation is the method by which we do this. With evaluation, we can make improvements on program design and analyze whether the activity has achieved its objectives. Folks with the Centers for Disease Control and Prevention have put together a recommended framework for evaluating public health programs, as depicted in this diagram. As you can see, evaluation is a cyclical process, with no clear beginning or end, and, of course, data is an important factor throughout the process. You would use data in describing the program, specifically in outlining the potential and expected effect. As you focus on your evaluation design, you would use data in selecting appropriate outcomes for measurement and establishing baseline measures. When gathering credible evidence during your evaluation, you would determine the data elements you'll want to collect so that you can measure the outcome of interest. You would justify your conclusions by using the supporting data that you've collected. Using and sharing lessons learned could start with the presentation of evaluation findings to a wide audience, including stakeholders, which will help you engage them to be active or informed participants in the public health activity and its evaluation. Data does play a key role in all aspects of the program evaluation.